It's time to look at another previous year question. Look at the one down here, posterior interosseous nerve. So this has been asked in the recent exam for 5 marks. They want you to explain the origin, the course, the branches and termination of posterior interosseous nerve. So where is posterior interosseous nerve? Obviously posterior, that is backside of you, right? So the just your forearm backside you look at, okay, that is this side here. Forearm backside, what do you have? You have the radius and the ulna, right? So radius you have laterally and ulna you have medially. This is the posterior view, remember. And in between these two bones you have the interosseous membrane, right? What do you have between the bones? Interosseous. What is osseous? Osseous refers to the bone. Interosseous. Between the bones, you have a membrane. Interosseous membrane. Now, is there some nerve here which goes here? I'll put it in, let us say, pink color, okay, because it is already yellow in this image. So, is there some nerve which goes here, and hence its name is posterior interosseous nerve, PIN, right? PIN. So, we're studying about PIN now, posterior interosseous nerve. So, you've understood the context. Where is the posterior interosseous nerve? First of all, that you should have in your head. So, it is where? In the back of your forearm. That is in the dorsal aspect, okay. So why is it important? Why are they asking you this? Because in injury to this there can be a wrist drop, okay. So wrist drop, you have always studied about wrist drop in the context of radial nerve. Yes, so posterior interosseous nerve actually arises from the radial nerve. See here, you can see posterior interosseous nerve they have shown here, right, and supplying all the dorsal muscles of your forearm. You can see here posterior interosseous nerve. It is in relation to the supinator they have shown. So it's going inside the supinator or something and it is coming. So you have seen overall what posterior interosseous nerve is, why it is important. So they are asking the origin, course, branches and termination of posterior interosseous nerve. So it is it's a nerve. What nerve? It is a nerve of the back of your forearm. Very important nerve in the back of your forearm. It is coming from where? Radial nerve. We already told you this. This is posterior view, remember. So radial nerve. And from this radial nerve, where exactly are you getting the branch, this posterior interosseous nerve? You're getting it in the cubital fossa. It is giving this branch, that is the posterior interosseous nerve, right? And if somebody asks you the origin, what will you say? The origin is the radial nerve. It arises from the radial nerve as a branch where it is given off in the cubital fossa just below the humerus, right? Which part of the humerus? Just below the level of the lateral epicondyle of the humerus. So this is lateral, this is medial, this is posterior view, remember. So just below the level of the lateral epicondyle of the humerus. See here you can see the radial nerve itself is from the posterior cord and it kind of goes posterior behind your humerus, right? And it is coming in front and somewhere here at this end after the humerus, it is giving the posterior interosseous nerve, remember. And radial nerve root, brachial plexus, C5, C6, C7, C8 and T1. See here, spinal, right? C5, C6, C7, C8, T1. Posterior cord is giving the radial nerve. But remember, they have not asked you about radial nerve. They have asked you about what in the exam? Posterior interosseous nerve. So you need to know the origin. You know the origin now. So now you tell the course. If they ask the course, you will say it begins in the cubital fossa. It passes through the supinator muscle. We already showed you the supinator muscle. And then it will come to the back of the forearm and it descends downwards. Okay. So this is downwards anatomically. So it is descending downwards, they are saying. Here's the supinator. We told you, right? It passes through the supinator muscle, right? That they have shown here, right, for you. And then what happens? It goes, and it ends in a pseudo ganglion in the fourth compartment of the extensor retinaculum. So let's look at that now. So here they have shown you it ends here as in a pseudo ganglion, right? That means it's not a real ganglion kind of thing, and where it is behind the wrist joint, it will terminate, right? So it will not go beyond your wrist joint. Remember this nerve, it will just terminate there. How? As a pseudo ganglion in the fourth compartment of the extensor retinaculum. So extensor retinaculum, if you have seen, see the back of your right arm. So here somewhere, here, back side here, okay. anatomically. So that's where you should be having your extensor retinaculum. See this green band here that they have shown. This is only extensor retinaculum, back side, remember. Okay, in front what do you have? What retinaculum? There also you have a carpal tunnel syndrome which happens now because of something. Yes, correct. In front you have the flexor retinaculum. Back you have the extensor retinaculum. Extensor retinaculum, right? That one, if you look at, so here you can see the right hand, right? Now you just imagine this. Your right hand, the thumb. See, you position your thumb and hand like this that they are showing here. Like this you position your hand, okay? The right thumb is here, right? Now, under your bones, that is the radius and the ulna, you have this extensor retinaculum, in which in the fourth compartment, which is this is the fourth compartment. So this is 1, 2, 3, 4. For whatever reason, they are counting it from the lateral side. 1, 2, 3, 4. That is from the thumb side, okay? 1, 2, 3, 4. In the fourth extensor retinacular compartment, you have what? The posterior interosseous nerve. You can see only one of them they have shown nerve here. That is where it is, okay? Okay, so this is the course of the posterior interosseous nerve. It begins where? Cubital fossa, and ends where? Here, just before your wrist, okay? Next part of the question is the branches, okay? So what are they asking you? The branches of the posterior interosseous nerve. Very easy. So branches means what you have to talk about. See, there are muscular branches and articular branches. So it will supply some muscles, and some articular means what? It will supply some joints, is it? Correct. So it will supply some muscles and it will supply some joints. So muscular branches and articular branch. So you have actually muscular branches, articular branches, and even sensory branch. In articular branch, what did you see? It will give to wrist joint, distal radioulnar joint, and also intercarpal and intermetacarpal joint. Okay. Then coming to sensory, to this interosseous membrane. Remember, between the radius and ulna, you have the interosseous membrane. To that, it will give the sensory branch. Okay. So only what is left now? Muscular branch you have to learn. See, in muscular branches, there seem to be some divisions like short branch, long branch. In long, again, they have medial long, etc. Anyways, we'll come to this. Before piercing the supinator, you have the branches given to extensor carpi radialis brevis and to supinator. Okay, so extensor carpi radialis brevis, to extensor carpi radialis brevis, and to supinator it is giving. So before it becomes a short and long itself, it is giving to extensor carpi radialis brevis and supinator. Supinator you can remember. How will you remember extensor carpi radialis brevis? This you have to remember. Okay. Now, while passing through the supinator muscle, it will also give one branch to supinator. Okay. Then, now let us look at the, after emerging from the supinator, what will happen? It will give short branches. 3 short branches are there. What are those 3 short, cute, small branches? Extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. Okay, so here we have the ulna, here we have the radius. So on this side you have radialis brevis, here you have the ulnaris. There is no brevis here. Okay, but this is a short branch. Remember, 3 of them: extensor digitorum, extensor digiti minimi, and carpi ulnaris. Remember, 2 of them are digit. Okay. Now let's come to the long branches. Okay. So long branches, you have medial and lateral. Lateral always will be what? Medial will always be what? It's difficult to say. There is no logic here. So the lateral branch. Where is lateral branch? Oh, here. The long lateral branch, it will supply the abductor pollicis longus and extensor pollicis brevis. Okay. And here on this side, you have the extensor pollicis longus, extensor indicis. Okay. Is there a trick to remember this, guys? So let us see. Everything is extensor. Okay. See, it started off with the extensor radialis brevis, extensor digitorum, extensor digiti minimi. See, supinator I have not mentioned. It doesn't have extensor word. What I'm trying to focus on is everything has extensor word. Okay, except for this abductor pollicis longus, which is on the lateral. Okay, which is getting the lateral long branch. Okay. See this course of this nerve, right? So what happens is they are showing that if this is the nerve, posterior interosseous nerve, see here, you're getting here lateral branches. What are you getting? Abductor pollicis longus, extensor pollicis brevis, and medial branches, what you're getting? Extensor pollicis longus, right? These are the muscles. If you see, if you compare these two, it may not be the exact comparison, but see, if you arrange it here, extensor pollicis longus here, right? And on this side, what do you have? The lateral side, you have the abductor pollicis longus and the extensor pollicis brevis. So if you want, you can just remember this course of this nerve, okay? But according to the textbook, all you have to understand is the way it goes via the supinator. That is the most important thing that you need to know. Guys, when it comes to wrist drop, there are many muscles, right, that get that are the cause. The one that you have to remember for this for this question is the posterior interosseous nerve. If it is affected, which is supplying this extensor digitorum, that time you have the wrist drop. Okay, so basically a lot of reasons are there for what am I saying? Wrist drop. One of them is this extensor digitorum muscle, okay? Which drop? That is radial nerve palsy. One of the muscles that we are talking about, extensor digitorum, is supplied by that posterior interosseous nerve. And interestingly, there is no anterior interosseous nerve. How strange, right? Okay. So did you understand this question? Posterior interosseous nerve, origin, course, branches, and termination. So posterior interosseous nerve at the back of your forearm here, coming from radial nerve. It starts at the cubital fossa and it goes and ends just before your wrist as a pseudoganglion. Remember, when it is branching, it comes through the supinator. You can see below the supinator. And if there is injury, then the extensor digitorum is affected and other two muscles are affected because of the radial nerve. It will lead to wrist drop. And that is why they're asking you this question. Why is it called interosseous? Because between these two bones, radius and ulna, you have an interosseous membrane that is between two bones. And here itself, this nerve has its course. So it is called as posterior interosseous nerve. Okay. So what are the branches? The branches you have seen, you have a branch to the extensor carpi radialis brevis, to the supinator, and then one more branch in the supinator. Then short branches you have to extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. Then you have long branch on this side, medial branch and lateral branch. Medial branch, extensor pollicis longus, extensor indicis. Lateral branch to abductor pollicis longus, extensor pollicis brevis. Most of them have the word extensor in them. Remember, all these are muscular branches. And then you have articular branches. See, muscular branches, you are able to see the diagram. Articular branches means to some joints, wrist joint, distal radio-ulnar joint. Then even to the intercarpal joint and then intermetacarpal joint, you have the branches, articular branches. Then you also have the sensory branch where to this interosseous membrane, you have the sensory branch. Okay. So then how does it terminate? It terminates here as a pseudoganglion. You can see here it terminates here as a pseudoganglion and it also is in the fourth compartment of the extensor retinaculum. So actually it terminates where? Just behind the wrist joint. And then actually some branches are there, it says, for the carpal bones and metacarpal joints. But anyways, the termination, you remember, is just before the wrist joint is what the textbook says. So here you have your extensor retinaculum, right? Here you have your extensor retinaculum in the fourth compartment, 1, 2, 3, 4, fourth compartment. Here you can see the posterior interosseous nerve. Okay. So remember to draw a man in the exam. From behind like this hand you can draw, and here you can just draw one nerve like this and show that this is the posterior interosseous nerve. And here you have the radius laterally and the ulna medially, and between you have the interosseous membrane, in that you have the posterior interosseous nerve. Okay, this diagram can fetch you a lot of marks because that is the anatomical location you can remember, remaining you can write. So here, there is one more point that you'll have to focus on, is the relation. Okay, when you're talking about the relation, the course, you need to talk about the relation also. So what we are saying is this muscle, this nerve, posterior interosseous nerve, it leaves the cubital fossa, right?
it enters the back of the forearm by passing between the two plane of fibers of the supinator. So between two plane of fibers of the supinator it will come, right, and then it will wind backwards around the lateral side of the radius. So which exactly is the radius here and which exactly is the ulna? This seems to be the ulna. So this is the ulna and this is the radius. So it is winding around within the muscle. It winds backwards around the lateral side of the radius. Okay, within the muscle. Here it emerges from the supinator on the back of the forearm. Here it lies between the superficial and the deep muscles that you can see here. Here. So it lies between the superficial and the deep muscles. You can see the nerve here lying between the superficial and the deep muscles. At the lower border of the extensor pollicis brevis, it passes deep to the extensor pollicis longus. So here you have the extensor pollicis longus they have shown here. So after this extensor pollicis brevis, it goes here, and then here you have the extensor pollicis longus, right? It passes deep to the extensor pollicis longus. It runs on the posterior surface of the interosseous membrane up to the wrist, where it emerges as a pseudoganglion, which we have said here. It emerges as what? A pseudoganglion, right? So here they have shown pseudoganglion, and it ends up by supplying what? The wrist and the intercarpal joints, which we have already told you in the articular branches.